Well, welcome new folks. Wow, there's a lot. We've got a whole bunches. So that's good. We got the old crew leaving, and now we have the new class popping in. So the new folks, you guys will be where they are here shortly enough through the process, okay? I'll explain the process, and that's going to kind of go what we're going to lecture a little bit about today anyways. There's a process to treatment. Okay, and then I'm going to kind of give you a general overview of what it is we're going to do in here for the new folks so that you guys aren't terrified, because it's odd and strange and uncomfortable to come into something that you haven't done before with certain vulnerabilities and then have to go through this process. You know, you're like, what's happening, and where do I fit into all this stuff? So I'm going to kind of explain all that, kind of put everybody at ease, all right? So basically, the class treatment or treatment service hours, class, counseling, therapy, group therapy, whatever you call it. It goes by many names. Basically, it's about, in here, our facility, ARC of Tampa, what we're trying to do is put together a therapeutic approach to educating people on how to self-identify dysfunction, recognize it, where it comes from, how it progresses, what to do about it, and then the process involved, and guide people through that. Now, is this helpful only to people suffering with depression, anxiety, and addiction? No, it's for everybody. Any human being that's struggling in life right now would benefit greatly from this. It could change your life for the better if you apply it. Nobody's forcing you to apply it. That's rule number one in behavioral medicine. Rule number two, really, know thyself is the first one. The second one is you can't help anybody that doesn't want help. Okay? But what I'm here to do is tell you the truth. I'm here to tell you the truth about how things work, where things came from, and how to do something about it. What you do about it is up to you, but you will hear the truth. And guess what I find most often is people do not like the truth. In fact, they despise it. As much as they say they like it, as much as they say they want to hear it, when I tell them it, they dislike it quite a bit, and they get angry and frustrated by it. That's okay, that's part of the process. I just ask that you keep an open mind to the concepts and to the lecture and to the materials that we go over. They'll be self-evident. Everything I say can be quantified with self-evidence. Okay, so that being said, what are we here to learn? Well, we have to first define what dysfunction is. And dysfunction, I'd like to use that word better than mental illness or addiction, because everybody has some level of dysfunction. When the dysfunction becomes chronic and consistent, we call it mental illness or substance addiction, dependence, and all that other stuff. And we have codes for it and all that other good stuff. Do we really want to typecast everybody into a categorization of disease model, with a name to it? I think that sometimes does more harm than good, because there's a stigma to it. Everybody knows what dysfunction is. Everybody knows what life struggle is. Everybody knows what needing a little help is. And that's just normal. It's normal for everybody to struggle at some point or multiple times throughout life. That's part of life. So to understand that, but sometimes we get stuck, and this is where the problem is. It's not stress and anxiety. It's not being able to cope and deal with it consistently. And when you get stuck at that point, what happens is sometimes people have a tendency to compensate that with drugs, alcohol, or behaviors, or what we call maladaptive coping, doing behaviors that are actually self-destructive or harmful to you. Even though they provide temporary relief, they end up causing more harm than the original dysfunction. Does that make sense? If I'm depressed and I start to drink alcohol because it makes me feel better, or smoke weed because it makes me feel better temporarily, in the end, what happens? I alter the chemistry in my brain. It causes the depression to be worse. It causes sleep problem, other issues. Same with alcohol, pills, and behaviors. Believe it or not, behaviors are just as bad and they're just as dysfunctional as abusing alcohol or drugs. So what we want to do in here is to kind of put things into perspective. We want to kind of assess, where are we at? Am I happy? Am I living life, or am I existing in life? And there's a big difference between pleasure and happiness. And we have to delineate the two, and we have to find out where in the spectrum you are. Because if you're not self-aware of how you're functioning in life and where you're at, where you want to go and what you want to do, it's going to be a rough ride. It's going to be a horrible, horrible ride for you. Filled with depression, anxiety, insecurity, uncertainty, loneliness, fear, all kinds of horrible things. Now, to some degree, we all have to go through that a little bit. It's called sacrifice, and it's called, learning in life. We have to go through pain and suffering and sorrow and hurt and anguish in order to learn how to cope and deal with life. Because life is a series of that. But if you get good at coping with it and good at dealing with it and understanding it and how it works and what you can do to make it better, life becomes good, and it becomes prosperous, and it helps you to become well. So I want to teach people how to do that.